Well, thank you again for having me, JBBA. We've been a part of this organization since 2018. I'm Chrissa McFarlane, founder and CEO of Patientory Inc., and also the current board chair of the Patientory Association. So over the past decade, my team and I, we've been on a mission to revolutionize how we manage health data using these emerging technologies as blockchain, crypto, as we now have rebranded it to Web3. So I'm excited to share how the Patientory ecosystem is empowering people to own their health data, drive better outcomes, and transform care systems globally. I'm using Web3 and a lot of that information, which was presented earlier in the other presentations. I will be sharing our successes in bringing this revolutionary technology to market, from just a complex white paper a decade ago to the current challenges we're currently facing and our vision for the future. So let's talk about the problem. First, we'll rewind back to our interview we published with the British Blockchain Association. It was also presented at the ISC by my colleague Marquesa French on behalf of the Patientory Association, which address a lot of these challenges, inefficiencies, chronic diseases, a failing centralized system, and the rise of health data breaches and ransomwares. Unfortunately, things have not changed for the better. And in fact, it's gotten worse. We've seen in current events, companies such as 23andMe, you know, attack on genetic data and the ransomware that they face in resulting in bankruptcy, right? So it's this urge, it's this push that we need to have patients in control of their data. So healthcare systems today around the world are buckling under pressure. In the US alone, that I can speak to, over 300 billion is lost annually due to these inefficiencies. Chronic diseases affect 6 in 10 adults, and care is fragmented. Even worse, over 133 million health records were breached just last year. So centralized cloud internet systems are outdated. Systems are failing to meet the needs of these modern patients. So how does blockchain help? These cases shown here are written all over the globe since 2018. As we know, healthcare innovation can also take up to a decade to gain traction. We wrote an article in the Blockchain and Healthcare Today Journal in 2018, which was titled Pragmatic Interdisciplinary Perspectives on Blockchain and Distributed Ledger Technology. That article was downloaded more than 6,000 times from over 70 countries and was cited in over 55 articles. The themes we explored, such as minimizing on-chain data to align with GDPR and HIPAA, leveraging permission ledgers for trusts, extending Firebase APIs to enable blockchain interoperability, are now foundational to real-world pilots and production-grade healthcare solutions. So what was once forward thinking a decade ago has become the blueprint for responsible innovation. Blockchain offers immutable audit trails, transparency, and secure data exchange. Patients can own their data through self-sovereign identity, while smart contracts allow automation for administrative processes. It's the foundation for a more connected, efficient, and also equitable healthcare system. So at the center of this transformation, we have the Patientory ecosystem. We've broken it down into the association, which is a membership organization that governs standards and promotes interoperability. The PTOI Matrix blockchain network is essentially, what we've built from the ground up, ensures HIPAA compliant data exchange in our data storage ecosystem, which is also integrated with our native token. The Patientory app serves as a digital health wallet and an AI care navigator. And for enterprises, developers, our SDK stack powers integration into existing systems. So how does the P2 Matrix blockchain work? The blockchain is already being applied in real-world settings across healthcare. First, we're enabling decentralized clinical trials where patients can consent and securely share data with researchers, eliminating intermediaries and accelerating trial recruitment. Second, the health data wallet gives individuals control over their medical history, whether they're seeing a specialist in the UK or managing, chronic care abroad. Their data follows them securely and compliantly. We started out in the Southeast US to date, and we've built a national health information exchange through current US initiatives like TEFCA and Care Equality. Third, for chronic disease management, the blockchain powers token-based reward systems that increase care, plan adherence. And this is actually a game changer for employers and insurers seeking more measurable outcomes and how to track and save costs. And you guys saw a picture of our app, which Mark shared in his presentation. We're also at the moment piloting cross-border health ID programs. One of our health IAL verifiers um, currently helps migrants, Syrian migrants. We're using it as well for travelers and telehealth patients to access care without losing continuity. So behind the scenes, the blockchain serves as a population health analytics layer, feeding anonymized, consented data into AI models for better public health decisions. And finally, we're integrating tokenized wellness incentives from everything from, tracking steps to mental health check-ins, and wearable device integrations with one of our recent um, partnerships with Google Cloud and the Google Fitbit team. So blockchain is not a buzzword, but we're really piloting it and seeing it as a real infrastructure that's live, scalable, and delivering impact today. So our team bundled those blockchain use cases into our wallet application um, for which services the health data wallet. Members use a decentralized ID to manage their health data through consent-based sharing. And we currently go after providers, employers, and insurers to manage from a population health standpoint. So what results are we seeing? We've done peer-reviewed articles and published research as well, where we can adhere to, employers using the platform can report up to 30% cost savings. Chronic condition adherence has improved by 40%. And we're also seeing clinical trial recruitment timelines cut in half. So one of our pilots, we helped Moderna during about 4 years ago during the COVID-19 to get to their phase 3 clinical trials, which they also, wrote and reported that on their website as well. So where we are today, we really find our association, which, culminates ambassadors from all over the world. It's more than a steward of blockchain infrastructure. It's a global coalition setting data standards, aligning with policies like the Cures Act, GDPR, and enabling decentralized health innovation. As Byrne mentioned, the NHS digital first agenda aligns perfectly, with what's happening in the marketplace today with blockchain, with the UK being a leader in blockchain, with the creation of the BBA roadmap. We really see it as a huge potential for implementing GDPR compliant data donation marketplaces, decentralized clinical trials, and cross-border health identity pilots. Looking ahead, from our perspective, our association, which culminates ambassadors from all over the world, we're looking to pilot and expand our nodes into Asia, Africa, and across Europe. We're also launching research hubs that use AI and Web3 to improve population health and power community-owned data ecosystems. So our call to action, if you're a researcher, employer, health innovator, or policymaker, we invite you to join us at the patientoryassociation.org to become a member, run a node, pilot, the Patientory Inc. wallet, which is a member of the association and our first use case for patient-owned data, or just contribute to our evolving Web3 health economy through tokenized, opportunities. So I want to thank you guys today. You can also email me directly, Chrissa@patientory.com, and continue co-creating the future of health together.
Thank you so much, Chrissa. It's great to hear from you, and it's wonderful to see how there's real synergy between what's happening in the US and the demands of markets like the UK, when the NHS is also very keen to drive innovation. We will definitely connect you all. As I said, there's so much in common, and I know that we've got various other members of the audience today that are also developing and evolving solutions. So yeah, it's great to have this forum today.